Some of us who've been doing this a while like to joke we may have more registries now than we actually have patients. And there are many, many different registries around the world. One of the first, of course, was the International T-cell lymphoma project. And subsequent to that, the complete registry led by Francine Foss. There's a Czech registry that we heard about from Dr. Tierney from Prague. Massimo Federico has run a registry called the T-cell Project that has nearly 2,000 patients in it. And the Danish have reported their own registry. So what's now being floated in the field is, can we leverage all the different strengths of these different registries and try to compile them into a single registry where we can build the numbers of patients with all the different more rare subtypes of T-cell lymphoma to garnish a better insight into the natural history of the disease. And so this is something that's being debated amongst the principal investigators who control these different registries, but they do continue to share a common theme, and that common theme remains that despite many new drugs, not all of which are actually approved in the countries which have shared the registries, that the disease is still a very poor prognostic disease. It tends still to be a disease where frontline CHOP chemotherapy is suboptimal. It remains a disease where it is unclear from the registries whether one regimen is better than another or whether consolidation with transplant is better to do than not to do. So there's a lot of questions that still remain, but I think as we move forward in the field, at least we now have the basis for trying to keep track of this information and prospectively follow patients to see what impact, if any, new drugs might have on the natural history of the disease, to see what, if any, some of these new regimens like the ACHP regimen might have in the upfront treatment of the disease. So it's going to be a work in progress, but I do think that there's a honest interest in trying to coalesce these different international registries to try to get more power, more strength around the natural history of these more rare subtypes of the disease.